Good day. You are welcome to Proudly Dental Therapist Forum, where we discuss some basic things in dental that can cause problem and some solution in our own little way. We are not treating people on this forum. We only give tips on some dental problem which we can advise people on what they should do. We always encourage people to, once you have a problem, it's better you go to dental clinic for better treatment. What we are doing here, we are just trying to enlighten people on some basic things. So we are begging you to please go on our YouTube channel, Proudly Dental Therapist, and please subscribe to our YouTube channel. That's the only way we can keep up going. When we see people subscribe to our YouTube channel, it motivates us to go on and to discuss some other things. So we are pleading, please go to our YouTube channel and subscribe on our YouTube channel, Proudly Dental Therapist. Today we'll be discussing on a very popular disease that is common. In those days, we believe is common with the elderly, but these days it is not. It does not really matter who you are. Even to some people, it's the disease of the rich, even the poor too. So that's why I always advise my people or my patients that once you are clocking that age of 40 years, it is good for you to know your sugar level. So we're going to be discussing on diabetes mellitus. We all know diabetes mellitus is a kind of disease that cause high blood sugar level in the body. To a layman, diabetes mellitus is just when you have excess sugar in the blood that the body system unable to convert to energy and is now causing problem. That's just it. Diabetes can be very harmful if it's not attended to early enough, or if you don't even know you're having it. It can cause a lot of damages. It can cause a lot of things. That's why it's very important for us to know our sugar level. Once you are clocking 40 years, you are approaching 40 years, it's good for you to always know your sugar level. It's very important. So you will not be a victim of circumstances. Because once this diabetes is not treated, it can cause a lot of problem. It can destroy the nerves, it can destroy the eyes, it can destroy the kidney. Even healing will be difficult to happen, and it can even destroy some of the vital organs like the heart. So that's why it's very important for us to always know our sugar level before it now becomes something else. Diabetes can be of two forms. We have the type 1 and we have the type 2. The type 2 is just when we're talking about the autoimmune. You know, we have there is kind of immune system that everybody has that fight against any kind of harmful bacteria in the body. But under this diabetics type 1, the autoimmune attack the cell where the insulin are made. It attacks the cell. So once it attacks the cell, definitely such person will not have enough insulin or even insulin at all that can kind of regulate the sugar level. And as a result of that, there will be a problem. There will be a serious problem in that person's life. And for the type 2 is just talking about when the body become resistant to insulin. And once that happens, there will be buildups of sugar in the blood, and it will be useless to the body because the body will be unable to convert that to energy, and will now cause problem. It will cause problem to whosoever that is a victim of such. That's why it's very important. We are making emphasis on this program, that it's good for us to always know our sugar level. You just go to the dental clinic or any to the hospital that you want to check your sugar level. Is simple as ABC to avert some of this problem. Now, how does diabetics mellitus relate to the oral hygiene or oral cavity? It is very, very rampant that someone is having excess sugar in the body. The chances of them having periodontal problem is very, very high. What is periodontal problem? We're just referring periodontal disease. We're referring to a layman. Periodontal are those structures that hold a particular tooth, the gum, the bone, all the supporting structures of a particular tooth. Now, for someone that is suffering from diabetics, they tend to have serious periodontal problem. And when that occur, it will affect the supporting structure of that particular tooth, and it can lead to pains. Once your supporting structure of the tooth is having problem, it will lead to pain. It can lead to bad breath. It can lead to even chewing will be very difficult for them. Tooth loss. It can lead to tooth loss. The supporting structure has been affected as a result of the condition of the diabetes that the person is having. So it can lead to tooth loss. It happens once the supporting structure has been affected. The structure that is holding a particular tooth has been affected as well. So the tooth can pull off any moment. That's why it's very common with people that is having diabetics. They're always having gross mobile tooth. They always have gross mobile. That is, most of the side of their teeth is shaking, is mobile. It's very, very common with people that have diabetics. That's even when a patient is complaining, he or she may not even know that he's having diabetics. But when he starts complaining, you as a physician, you attend to a patient and you notice this patient is having about 4, 5, 6 mobile tooth. It's a sign that there is a problem somewhere. Probably a person is having diabetes mellitus. So you just advise the person, when last have you done your sugar level test? And if he or she has not done that, you quickly advise the person to go and do that, because that's a pointer that is likely this patient is having diabetics. Another thing that can happen again is once someone have a dry mouth. Being a diabetic patient, the drugs someone is going to take, some of the adverse effects of this drug can prevent the flow of saliva. And once your saliva is not flowing the way it's supposed to flow, there is a problem. Because naturally, saliva serves as natural self-cleansing. They serve as natural self-cleansings for the mouth. By the time we finish eating, some of this food gets stuck to every angles, all the areas of our teeth. So the saliva also help in cleaning the teeth and dislodging any kind of leftover food. So once that saliva, there is no flow of saliva in the mouth, you notice you don't have it, you should be suspecting is a pointer to you having a problem probably with diabetics. And once there is no flow of saliva in the mouth, it can easily lead to soreness of the mouth. There will be sore all over the mouth. because the lubricant that's supposed to lubricate the whole mouth is missing. The mouth will be dry, and it will lead to sore. There will be soreness in the mouth. There will be ulcer. There will be ulcer. You see wounds in the mouth, and there will be infection as well. And once infection happens, settings to decay will set in. There will be burning mouth. Your mouth will just be aching you unnecessarily. It will be paining you unnecessarily. And one thing that can also happen, because there is a limit in the flow of saliva, and that person is having diabetes as well, the sugar level in the content of the saliva will be very, very high. So once the content of saliva is very high with sugar, and the saliva serve as self-cleansing. Any areas of the mouth that the saliva is going to touch, because the saliva has high concentration of sugar, definitely caries will be forming in that area. What is caries? Just you having holes, toothache, start forming in that area, and as a result of that, there will be a lot of problems that are going to set in. That's why it's very, very important. Like I said earlier, once you are approaching that year of 40 years, it's good for you to know your sugar level. It's very, very, very important to you. Very, very important. So what are the things you can check up or you can look out for in the mouth that can be a pointer to you having a diabetics? Some people, you just see swelling of the gum unnecessarily. They will bleed probably when they are brushing or when they are flossing. They will bleed unnecessarily. There will be swollen gum. The mouth will be very, very dry. Very, very dry. There will be sore all over, and there is kind of white patches all over the mouth. That's a pointer that you're having diabetics. And also you may have bad taste. There will be a bad taste in the mouth. It's a real pointer that you are having diabetics. And that's why it's very, very important for you to know your sugar level. For everything that happens to man, the way you will see the manifestation, the easier place that you can see the manifestation is your oral cavity. So if those things I've listed out, if you notice you are having them, definitely is a kind of pointer for you having diabetics. And that's the more reason why you should visit a dental clinic for necessary checkup for you to know what you should do. Now, I want to really talk about for someone who you have the diabetes already. There's some things you should take and there's some things you should not take. I have the list here which I'm going to read out one after the other because they are much. I'm trying to discuss this so most people will now know those local food we can take and those local food we cannot take. Because we are talking to Nigerians, we are talking to people locally. What is applicable in the Western world may not be applicable in this side. So I try to do the research to see some of those local foods that is good for you to take and the one that you cannot take once you have diabetics, once you are a diabetes patient. So it will not worsen the case of your diabetes diseases. So I have some list here which I'm going to be reading out. One of the foods that you can take once you are a diabetic patient, one is bitter leaf soup. Bitter leaf soup is very, very good for a diabetic patient because it helps to reduce the body sugar. Bitter leaf soup is very, very good for you to take. Then it's good also for you to take water leaf soup. It's good for you because it contains low sugar as well. It contains low sugar. Afang soup is very, very good because it controls sugar Sugar, it controls sugar generally. It's very, very good. Ewedu soup is good. Green leaf vegetable is perfect for you once you are a diabetes patient. Then it's good for you to take amala that is from unripe plantain. It's very, very good. It's highly recommended for diabetic patients. It's highly recommended. Unripe plantain is very, very good as well. Then it's good for you to take liver meat. It's good. Pomo we are referring to the cow skin, is good as well. Then it's good for you to always to add yogurt to your meal plan. It's good for a diabetic patient as well. It's good for you to eat cocoyam or you pound it for a soup. It's good for you as a diabetic patient. It's good for you to eat seafood like crabs, sea fish. Is very, very good for you. It's good for you to take snail. Once you're a diabetic patient, it's good for you to take snail. It's very, very good for you. If you want to take chicken, it's advisable for you to peel the skin because the skin is high in fat and it may worsen your case. So once you peel the skin, it's good for you to take it. Oil soup is very, very good for diabetic patients. Then if you want to eat white rice, don't consume too much of white rice. Just take little. Little is good. Little amount of rice is good, even for beans as well. Just take little, not you consuming too much of rice. Then another thing, if you are the person that enjoys to take swallow food, it's strongly advised for you to take wheat. Wheat is very, very good. You take wheat if you want to take swallow food. Then if it's good for you to take wheat bread as well. Taking white bread is not okay. So if you want to take bread, you take wheat. Wheat bread is very, very good. Take a lot of oranges, apple, mango, corn, Irish potato. You eat small banana. Is very, very good. Those are fruits. Fruit generally is very, very good for diabetic patient. Then you can take tuwo chinkafa as well. Tuwo masara is good. It's good to take bush meat. Bush meat is very, very good for you. Then if you want to take pap, you can take pap with milk, but no hard sugar. And it's very, very good for the kind of milk you're going to take. It's going to be 3 crown milk. 3 crown milk is very, very good because it's low in cholesterol. And it's very, very good for a patient that is diabetic. 3 crown milk is very, very good for them. Banga soup is very okay as well. It's good for you to take a banga soup. It's very good. You can eat goat meat. You can eat guava. You can eat garden eggs. It's very, very good for you. Eat plenty of vegetable. Oh my God, it's very, very good. You should form the habit of eating much vegetable. It helps to regulate the flow of sugar in your body. Is very, very good. Then if you can take ofada rice too. Ofada rice is good. Eat plenty of carrots, ogbono, okra soup is very, very okay. Sobo is good as well. Sobo is very, very good. Kunu is good. That one is very, very good for you. Then if you want to take packaged food like biscuits, take biscuits, fibers biscuits. Is very, very good. You take fiber biscuit, is very good. Then take garlic. Garlic is good for you as well. What you should not take as being a diabetic patient, things that you should not take, please avoid taking pounded yam or yam generally. It's not good for your health. It's because it contains much sugar. You know, the end product of carbohydrate is glucose. So it's not advisable for you to take pounded yam. It's not good. It's not advisable for you to take ripe plantain. It's not good too because it's carbohydrate. The end product is carbohydrate, and the end product of carbohydrate is glucose. It contains too much sugar. Avoid taking red meat. Red meat is not good for you at all. Do you know it's cow intestine like shaki, the rings or roundabout is not good at all for you. Don't take beer. Beer will kill you the more. Don't take dry gin. Dry gin will kill you the more. It's not advisable for you to take dry gin at all. It will kill you the more. Don't take dry gin at all, at all. It will kill you the more. So I'm advising you not to take dry gin at all because it does not, it has any good thing. It cannot do any good thing for you. Then don't take any soft drinks like Coke, Fanta, any kind of soft drink at all. Sport drinks is not good. Soda drink is not good. It's not even good for you to take fruit juice. It's not going to take fruit juice. It's advisable to take natural fruits. Don't take fruit juice at all. It's not good. Don't take sweet potato. It's not good at all because it's sugar. The sugar content is very high. Then please say no to eba. Say no to garri because it's high in carbohydrates. And the end product of carbohydrate, like I've been saying, is glucose. Then you should not take on like buns, egg roll, or meat pie. Is not good for you at all. Being a diabetes patient is not good for you at all. Now, how do we take care of you in the dental palace? Since you have diabetic patients, I will strongly advise you to always go for normal dental checkup. Because of the periodontal cases, the disease that you have, it's good for us to see and manage that cases for you. If not, it will be worsened and you may have a lot of problem. So always advise diabetic patient to at least you brush your mouth twice in a day. Brush your mouth twice in a day. You don't brush vigorously because once you brush vigorously and it pierces your gums, it can take time before it heals because of your condition. So you don't brush vigorously. You don't use hard nail toothbrush. That is, no, you don't use hard toothbrush at all because once you use hard toothbrush, it traumatizes your gum. It pierces the gum and it causes a lot of problem. And if you are the kind of people that use chewing stick, I won't discourage you from not using chewing stick, but you make sure the edge of that chewing stick is chewed and it's very, very soft. You chew it very, very well and it's very, very soft before you use it. Because if not very, very soft and it pierces your gum, there will be a problem. Healing may take time before it can happen. So it's not good for you to use chewing stick that is not well chewed. Then if you want to use, you don't use toothpick at all. Because once you use toothpick, it lacerates your gum. And there will be a problem. So you don't use toothpick at all. If you want to use anything at all, you use dental floss. And the kind of dental floss you use, it must be waxed. Because dental floss, we have the wax and the unwaxed one. So you make sure the dental floss you use is waxed. So it will easily penetrate in between your gum. So it will not cause any form of laceration at all. So it must be waxed dental floss. It's very, very important. Then if you are a patient that is using denture, make sure you remove your denture before you sleep. You put it in a container that has water. Then in the morning before you apply, you wash your denture very well after you finish brushing your mouth before you use. And if you notice your denture is not fixing properly on your gum, it's a pointer that there's a problem. So you quickly come to the dental clinic and complain. You don't wait until when the problem is very, very severe. Then don't use hard toothbrush, like I said. Don't smoke. Smoke is not good for your health at all. Smoking is dangerous to your health. You don't smoke at all. And the most important thing you do again is what we refer as scaling and polishing. You must always come to the dental clinic for scaling and polishing. Is very, very important. Because of that, your condition, you should not entertain any form of poor oral hygiene. Because once you have poor oral hygiene, it worsens the cases of that periodontal diseases. And it will have an adverse effect on your general health. So you should maintain good oral hygiene is very, very important. And how do you maintain the good oral hygiene? By coming to dental clinic for screening and polishing. And it's we, the dental therapists, it's dental therapists that will attend to you. Don't patronize quack. You patronize, you ask whoever that want to attend to you, are you a dental therapist? If the person is a dental therapist, it does not have the license to do scaling and polishing for you. So it's a dental therapist that will do scaling and polishing for you. So it's very important to go to dental clinic and do scaling and polishing to maintain good oral hygiene. So the cases of your diabetics will not get worsened each day. Diabetes condition is life treatment. You continue treating it. You manage it till someone's leave this heart. You manage it. So if you want, you can still live a normal life if you maintain basic health instructions. Being a diabetic patient does not mean it's a death sentence, especially if it is controlled diabetics. So you should not let your diabetics to lead to uncontrolled diabetes, whereby most of the things you are doing may not work again. So you should maintain your diabetics to a control stage whereby you will not have any problem. So that's why it's very important for you to follow the basic instructions that I'll be giving in this video today. We are just here to help you. So lastly, I will still advise you, for more videos on oral health, please subscribe to our YouTube channel, Proudly Dental Therapist, where we have some other videos where you can check. Please, we need your subscription. Subscribe on our YouTube channel. Thank you once again, and God bless.